he speaks to Sean Dowling, one of Ireland's few male midwives in Life on the Wards. And just to let you know, this programme contains themes of childbirth and loss.
Good morning, all. Good morning. It's a lovely morning, isn't it? Fantastic to be here.
My name is Sean Dowling. I'm a midwife in the Rotunda Hospital, and this is Monday morning, and I'm starting my shift today, and looking forward to whichever lady might come into the labour ward and to, help her through her day and hopefully have a satisfying delivery, So we don't know what to expect. We don't know who's going to come through and what might unfold as the day moves along.
Based in the Rotunda Hospital in Dublin, Sean Dowling is one of only around a dozen men working as a midwife in Ireland.
But we want to have a safe delivery. We want to look after the lady and be on her side, be her advocate, be her midwife, to be with woman and get her through this day and her partner and get that baby out. And well, I'm a midwife since 1993. I did my training in London, in England. It seems like eons ago. But I came to Rotunda in 1997, so now it's, I suppose, 27 years almost. So I'm almost part of the furniture, You have a little dust on the shoulders. And I love it. It's a great institution. It's a great hospital. It delivers great care. Our boast is that we're the oldest maternity hospital on the planet, busiest one in Europe, doing this since 1745, 280 years of delivering babies,
Sean has had a varied career, as he started out as a bus conductor with Dublin Bus and also worked as a motorcycle courier before taking up the nursing profession.
Oh, I'm a Dublin man. I'm actually from Walkins, Green Hills, Walkinstown. I live in Crumlin in Dublin. Went to school in St. Peter's Boys' School in Green Hills and then in Temple Old College. From there, ended up in Dublin Bus of all places, and did spend 3.5 lovely years in Dublin Bus as a conductor, a job that's now extinct. So was my second job as a motorcycle courier. But it was coming back from travelling. I got an urge during my time on the buses to go see the world. I was young, 21, dying to get adventure, and ended up in the Middle East. So I ended up travelling to Israel, Egypt, Sudan. Ended up working in Israel in the kibbutz right beside the Gaza Strip. Actually, we used to go swimming in the Gaza Strip. I came back home and wanted to do something more with my life. Didn't know what. Saw a picture in Our Lady's Hospital in Crumlin, where my little nephew was resident as a little inpatient, and I saw a photograph on the wall with Nurse of the Year 1987, and I thought, maybe I could do that. You never know. I mean, I was wondering did I have any caring bones in me, But I found out. I went to London. Well, it was 1989 that I went to London, and I was almost 24. So I would have been a mature student, which was extremely hard to get into anything in Ireland then, but not so hard in London. So off I went to London in 1989. That seems like eons ago, and started my nursing. I did 3 years. Became in the North Middlesex Hospital in London. Became a registered general nurse there. And in nursing, you're introduced to different areas of care. You've got your paediatrics, your A&E, your intensive care. So from that, maternity care I went into, and I just found it the most joyful and wonderful and uplifting thing. So I thought, maybe, don't have many men in that. Could I? And I'm still asking myself the question is why, perhaps I like to see new life,
And was there a stereotype back then for men becoming midwives? It wasn't that common, and it's still not that common.
There wasn't any midwives. It hadn't been midwife in the hospital I worked in for maybe 10 years. We're still like hen's teeth, and we're still few and far between, because we're like in nursing, I suppose nurses are about 5 to 10% of nurses, but we're very, very much a minority. You'd have to really want to do midwifery. You'd have to have liked the maternity world, the woman's world, because it's very, very much, it has been always a woman's profession. I can absolutely understand that. Since for eons, to be with woman, the woman was with woman, but now we have people can do what they want to do, and
how many midwives are here in Rotunda with you?
Well, there are 5 in the Rotunda, so I'm one, and we have 4 lovely Spanish lads who are working here with us as well. Two lads actually live in Madrid, and they travel back and forth to Ireland, and they're the best of midwives. And I think I'm the only one who lives in Dublin. But there you go. Is that my claim to fame? But yeah, we're few and far between. But I think maybe the girls tell us that we level things out a little sometimes. You know, a little bit. Are we the spice in the menu? I don't know, but we're there, and we're trying our best to be as good as they are. A rarity, but we do our best. And I love it. I mean, I love delivering babies. I had 2 babies on Friday, the lovely cesarean section, and then I had a lovely, gentle, normal delivery. It was a wonderful delivery on Friday. 2 beautiful baby girls. They're out into the world now. They'll go to school in 2030. You know, they're the whole new generation. I'll be retiring when they're going to school, and they've everything ahead of them, you know. I've had my share of so then it's wonderful to see them coming into the world. And
do you remember when you birthed your first baby and that experience?
Yeah, well, how nervous is a midwife when they do their first delivery? All thumbs. I remember it being a very uplifting experience. I remember it being a very scary experience, because the responsibility of delivering babies is great, I suppose. You know, you have to know what you're doing. You should know what you're doing. But like a new driver, or you know, you're new to the whole thing. So yeah, I suppose it's a sense of achievement, and you know, and then you go on from there. You get better as the year, or you should get better as the years go on.
And do you know how many babies you've helped bring into this world?
Yeah, I've asked that question every now and then. My rough guess would be about somewhere between, I'm going to say 4,000. I think on average I do probably about 300 babies a year. I'm in the job for nearly 30 years. But I wasn't on labour every year. So I suppose it would be a guess. But every single one of them are important, you know. So yeah, and you're only as good as your last delivery, in my head. So I think that we have to.
And what's your advice to parents when they come in and they might be a bit nervous? And do they see like a man approaching them and be like, do you sometimes think you're a doctor? Is that a...
Yes. One of the funnier things is when I've met ladies who perhaps are having an epidural, and we haven't got a chance to be properly introduced. And after a while, they look at me and they ask me, "What are you?" Not who are you, what are you? They know I'm Sean, and then we're not quite sure, am I a student doctor or what I am? And I think, no, I am your midwife. I'm the one. I don't look like one. I don't look what you might typify a midwife might look like, but there you go. And I suppose naturally, when you see difference, people are bound to have a little hesitation. I mean, that's only natural that you would be that way. But that's why I try to introduce myself and be friendly, and maybe a little light humour into the mix, and be warm, and take my time to explain to them what we're doing and how the day might unfold, and that I'm on their side, and that we can have a nice delivery, and we have to let it unfold. And once they believe that you're on their side, which I hope that communication does that to them, then off we go into the day's work that's in it, and aiming to get a nice, gentle, lovely delivery if we can. Safety first, and then satisfaction second, but as best as you can, get the nicest delivery you can, and hopefully they go away with good memories from what is a hard day's work. Labour is quite a it's a difficult day's work. I mean, it's probably the hardest day's work you may ever do. But with the right people around, and Rotunda is a good place to be. The midwives and the doctors work together, and we hopefully deliver the safest, best care in the world, you know.
As well as being a midwife in the Rotunda Hospital, Sean is very familiar with the history of the hospital.
These are all the patrons of Rotunda going back, as you can see there, up to 1752, when £500 was a huge amount of money. They They were I suppose institutions like hospitals were funded by private benevolent peoples who gave their hard-earned money or bequeathed money to the hospital, and they got their names written up on these. Yeah, and I suppose it's very much historical, we were built by a gentleman called Bartholomew Moss, he called himself man midwife, surgeon, barber. He was trained in Menorca and in Paris, and he worked in London, and he was in the British Army. His own wife unfortunately died in childbirth, and he was determined to make childbirth safe and not to have birth in yatties and damp cellars. So he wanted to build a proper place where ladies could be safe and have a baby. So we built the lying-in hospital for the poor women of Dublin, which is now known as Rotunda Hospital because of the rotund Ambassador Theatre, which used to have concerts and fundraising events, and it's part of historical Dublin now. So this Bartholomew Moss founded the Rotunda Hospital, and it's been here ever since. And it's a man who really should be honoured even more so, really, because they're like forgotten heroes of Ireland.
The historic Rotunda Chapel is often described as the jewel in the crown of the hospital. It's situated to the north of O'Connell Street, where it maintains a special place in the day-to-day life of patients and staff of the hospital.
The Rotunda main hall is here, so this would have been the front of the hospital when it was originally built. This is built in 1757, so with a grant from the king of the time, and Bartholomew must have a petition for that. And you come in through the front door of the hospital, and then you sweep up the stairs, which is here. And if we follow the stairs up, you'll see where we go.
It's a lovely building.
It is, isn't it? And they build with beauty. They weren't squares like modern buildings. They really put love into them. And I mean, this is an architect's delight, isn't it, to have the pillars and this. Look at the ceilings. Plasterwork is stunning. It's I don't think you'd be hard pressed to get any workers that are that skilled these days.
I know, and there's a lot of history to this building. Like when you think back to children that have been born here, and it's quite when you look out the window there.
Now, originally that would have been gardens. There was flower gardens where your wife with her beautiful new Sunday dress, and you paraded around the flower gardens on a Sunday to show off how affluent you were, and you paid your shilling in, and the shilling went to the lying-in hospital for the poor women of Dublin, to the upkeep of this place. And on Sunday, you would have come to church, and you would have come in through the front door and come up through these steps and swept through here and straight into a piece of art, a piece of work. Now, this is the postnatal ward. These doors would have probably closed across, allowing privacy for the ladies, and they would go into this beautiful chapel, which is absolutely stunning. It's one of Dublin's little gems, a gem that's hardly known about, but it's got a ceiling that's second to none. Stunning plasterwork by some wonderful Italian plaster workers, and it's just marvellous. You have the matron's seat, the master's seat, the board of governors' seat, and it's sitting here now for the last 280 years, but it's creaky floorboards, and look at that wonderful organ. Isn't that fantastic?
Yeah, it's stunning.
It is.
How important is a space like this for the Rotunda, and this beautiful stained glass window that listeners won't be able to see, but we're looking at here? The colours are amazing with the sunlight coming through.
I see some of the mothers some days coming in here to sit for a quiet moment. They're supposed to say a prayer. We have used this for. It used to be Sunday Mass and Sunday service. Not so much these days, but we certainly have our services for Christmas, and we have our carol service here, and then we have any maybe staff bereavement or something like that would certainly be here. But I suppose it was built by Bartholomew Moss as a centre for the Rotunda. It's a wonderful little gem of a chapel that I suppose gives praise to the creator of things, and we see the creations every day coming out into the world, and
Absolutely.
Yeah.
It's
So
and I think a lot of people don't know it's here.
No.
Because I didn't know it was here now, to be honest with you.
and most people don't, and they've never seen it. And on the rare occasions when some American tourists have read their guidebooks in detail, they know it's here, and they come knocking on the director of the Midwife store and ask, can he come go see it, but which is wonderful. There's a beautiful baptismal font over there for baptisms, and I've seen one baptism and I've seen one wedding here, but that's a long time ago. But anyways, it's a wonderful site, and it's utilised by us, and it's just a beauty. To me, it's stunning. You can nearly get a creak in your neck sitting up looking at the plasterwork in that ceiling, you know.
It's a nice space to come to in a busy day, I can imagine, for, as you said, a quiet moment.
Yes. Yeah, because most of our outcomes, and almost all of the outcomes, are very positive and wonderful. New babies into the world, new life, a whole new beginning. But on occasions when it's sad, it's very sad, you know. I mean, I suppose it's magnified even higher than in a hospital, in general nursing and health, you expect some bereavement, but with babies, you know, it's your whole life is pulled out from under you. It's a terrible thing, you know, and that's when you think people go back to where their spiritual centres are, and this is a quiet place you could sit and say a prayer and contemplate, and yeah.
And how do you deal with something like that? Because I'm not talking about the Rotunda now, but we have seen maternity services in Ireland where there isn't a positive outcome, and that is devastating for families and parents. But for some parents, it ends in tragedy.
Yeah.
And for you as a midwife, how do you process it, or can you?
You cry along with the woman. You be with her. You see her safely through the delivery of her little beautiful baby that unfortunately, for reasons we never will know, isn't for this world at this time. And we get upset, she gets upset, and we have to, whilst we're trying to remain professional, we feel it, you know. We have our counsellors, and we have our chaplain, who are they're wonderful people, but we are with her when on the event, and you just have to be with her. And I know myself, I've done a baptism. You know, there is people that want you to participate in their grief, in you know, saying a prayer or holding their hands or being quiet or whatever. It's very, very hard. But it's part of life, and we have to be with the women when these happen, and we don't always have the answers to give her, but maybe she can see that as humans we're on her side and we're with her.
And is it very difficult for the dad as well?
Dads are all very often trying to remain strong because somebody has to drive home, somebody has to keep it together, but dads can be devastated. You don't even realise how much you'll be affected until it actually happens, you know. You think as an adult, when you haven't cried for a long time, you won't cry, but you will. In the depth of your soul, you'll feel, you wonder, why us? Why is this cross being given to us? What did we do to deserve this? But you didn't. You do anything to deserve it. It is part of our lives that we don't know how long we'll be here in this world, but hopefully our families and midwives first, and the families as well, will be there with these people, good people, to help them through this hard time. And I don't suppose you'll ever get over it. You don't get over it, you learn to live with it. And then hopefully maybe you'll get a positive outcome next time, and you know that. But I suppose they are scars, you know. They're the hurts of life that so much hope goes into a baby, so much future thoughts. You think how the lives will unfold, and then it just doesn't unfold the way it ought to. But what can you do? That is life, you know. We see it all around in the news every day. Other people have bereavements, and you think, yeah, but when it's you, my God, it's real, you know, and it hurts, and it takes a long time, and they say time heals. Well, maybe it does a little bit, but it does take time, and maybe it probably comes to us all if you live long enough. And as midwives, we just hope to be there with you when that does happen, and hopefully your family will be with you for the rest. But it's hard. The labour ward is here on the right-hand side. So these are all the very hard-working midwives. You see these? They're the best midwives in the whole of Ireland are here in the Rotunda Hospital. And they're very hard-working. And actually it sounds like the place is very civilised, and there's they obviously have it all under control. But
this is where your life changes, essentially.
Absolutely. In there to have your beautiful baby and be looked after by super midwives. You can never ask for to be looked after by. And there you go. Anyway, no sound effects, so it's obviously everyone's very well looked after.
On average, a delivery, how long?
It can be as quick as 20 minutes. It can be as long as 10 hours. You know, ladies who come in through the emergency room ready to give birth, we have to be ready for them to come up and give birth very quickly. And the midwives are ready. But some labours take a long time. They're like a long haul flight to America, you know, that you just have to take off and take your time and wait for the descent and landing, you know. All that will happen, and the midwives have to be very, very patient. So they have to sit with the woman, be with the woman, and be very patient. So sometimes there's an awful lot of patience then required.
And you might just explain when the baby is born and you feel it might be in distress.
The midwives will snap to it immediately. We're always hyper aware of how babies are and when they're born. We're going to be obviously aiming for the most gentlest, slowest, nicest possible delivery there is. But at a time when we need to snap into action, we do, you know. And here comes a wee baby now. A beautiful little bambino, probably coming from theatre, heading off to the NICU to be cared for by another set of wonderful staff. They're the best NICU possibly in the country, you know. They have so much work, and you really couldn't ask to be in a better place than there, you know. So
I think you really see it there, this tiny little person that's an incubation.
A new bambino who maybe is a little bit premature and needs their help. And I mean, we work together with the NICU nurses because they are a whole different profession, and they're a whole different set of skills. We overlap to some degree, especially when new babies are born and need help. We midwives can resuscitate and take care of babies that suddenly need help, but we do need the NICU staff to come across then and take over from us and maybe take the baby for their intensive care, you know. We do our best. We work together with the doctors, work together with the NICU nurses, and hopefully deliver the best care that's possible.
There's a great smell of toast here.
Oh yeah, it's the famous tea and toast. It's I think it's the starvation in labour that leads to how tasty that toast tastes. But it's also addictive for night duty midwives as well, some more than others.
And another little baby going down.
Another beautiful baby, another wonderful baby. Yes, it's the new generation going to school in 2030. Who knows what we hope? They could be playing rugby for Ireland or football for Ireland. That's it.
And this baby is going down.
I don't know. We're going postnatal ward, yeah? And a beautiful boy. Huh? Ah, lovely. That's good. Well, congratulations. I'm so delighted for you. We'll see you next year. Okay, lovely. We're going to room 7. Room 7 is our water labour room. It's a new addition to the Rotunda Hospital where we can offer ladies a nice water labour if they like it. And I suppose it's a wonderful room. They've invested a lot in it. Oh, wow. Beautiful bath. I'd love to get in that myself. With beautiful coloured lights and a fine big room that's en suite. It's a marvellous. So this will be almost typical of all of the labour ward rooms.
Yeah, and you might describe what we're seeing.
I suppose it's a very white, very clean, I suppose a little bit clinical perhaps. It's got everything it needs, but it's also homely to some degree. There's a bed here for Mammy, a life delivery suite bed. A chair for Daddy. This is a twin room, so we've got 2 lovely resuscitators for the little twinnies that come along our way to be taken care of. We have a lovely water bath for those ladies who'd like to have a water labour.
And has that become more common in...
It has, yeah, and it's a great thing to be able to offer. You know, it was something that you have to have the facility for. We have it now, and those ladies who fit the criteria can get in and enjoy a water labour here, and then get out and have a baby with their midwife in the labouring bed when the time is right.
And this is where baby goes when...
Yes, well this is a platform for I suppose for checking a baby from head to toe, for weighing a baby, and if we want to give oxygen or suction, it's here as well. It's also got warmth and light, so we can, if needed, to resuscitate a baby. Here we are. This is the spot for it. But of course, the baby needs to be checked anyway at some point or other. Families want to know their weights just so they can send the messages home to the family. And we're still imperial. It's gas. We might think we're Europeans and we're in kilograms and litres, which we are. But when it comes to messages home to granny, you have to have pounds and ounces. So we're still never kind of lost that little tradition. So yes, this is our platform, and you can see here twin T1, T2, twin 1, twin 2. So this room is ready for a woman to come in, have a baby, and ready for twins. So if a woman walks in this door right now, this room is ready for her, and all she needs is a midwife.
For anyone that's listening, you know, particularly men, they're like, oh, I'd love to do that, but I'm afraid of what people... Have you come up against, you know, common stereotypes of years?
It's difficult to say who should be a midwife and who. Nursing brought me into midwifery, so I could see that being a pathway that might bring other men into it. It's possible to be a midwife by direct entry, straightforward, but it's then difficult to think of what man would have an aspiration to be in maternity care. But they can do it both ways. I think you need to really want to do it. You need to want to be a midwife, and you need to want to give care, and then you have to come into this female world, very female, very maternal. It's a whole world that most men aren't exposed to at all. But you can learn, you know, and we do our level best to. Well, I do my level best. I think it's just to show that if you love a place and to love a place, you have to put yourself into the place, and that you can have a very satisfying career in a place that you put yourself into and try. And then I think you have to make your mind up to like a place as well. You have to buy into the job. And I think this is a great job to deliver babies. I think it's very responsible. It's a very happy job. And I would get great satisfaction. It's lovely to come home after a nice, satisfying delivery when you know everyone is safe.
And if you've been affected by any of the issues discussed in this program, please go to rte.ie/helplines.